Hey everyone, this is Nisha again, and in today's video I will be talking about how our diagnostic and how I started having the chemo treatment. So for the ones that I don't know, about like more or less 3 months ago now, I were diagnostic with breast cancer. So I started feeling like a tingling sensation around my right nipple, and it was in the nighttime. And because my mom, she passed because she had a lung cancer about 10 years ago now. Since she passed, I was very traumatized. So every time I had something like some health issue, I always thought it could be a cancer. But I know that, and her cancer has absolutely nothing to do with mine, so it's not related. So at that night, I just thought, okay, Nisha, it's just like one more negative thought, and perhaps it's not anything. So it's just like just go to sleep and it will go away tomorrow. And it went away indeed. Like when I woke up, I was not feeling anything anymore, but I was still had that in the background of my mind. So I thought, okay, I will just go in front of the mirror and take a look on it. So I grabbed some moisturizing, which is a good tip for someone that wants to palpate and to do the test, because then you really feel deep and feel more. So I grabbed some moisturizing, and when I lift my arm, I didn't even need to pass that because I could already see the lump. But I touched anyways, and then I checked, and yes, I confirmed that it was a lump. So I called to my doctor. So I went to my GP, who is also a specialist in women's health, and I did it in the same day. So when I went there, he could palpate, and he felt, and he said like, yes, definitely it is a lump, but be calm, because 98% of the time it is just a fibrosis, it is something benign, and it will not be cancer. And he is right, but I told him at the same time, it's like I know my body, I know it doesn't belong to my body, and however I know that can be, it's more likely to be benign. I know it is not, so I don't want to have a cancer, I don't want to be pessimist, but I think that we have to go and check it straight away, because I want to get rid of it as soon as possible. So he said like, well, since you seem to be very nervous about it, I will try to have for you an ultrasound to be done today. So I went to the ultrasound, and then he called me and he said that, yes, you know what, it's like the image wasn't very well shaped. Generally when it's fibrosis, it's just very well shaped. When it's not very well shaped, doesn't mean that it's a cancer. Sometimes fibrosis can be quite tricky. So he said like, oh, well, it could be benign, but we have to go and check. So we have to go for a punction, have to go for a biopsy, which is the best diagnostic to see if that tissue of the skin, it's like of that tissue, the cells are cancerous cells or they're just normal cells. So just 1 or 2 days after that, I went to have this test done. And then in the same day that I had the test done, or 1 or 2 days later, this doctor called me and he said, Ligia, yes, you have to come here to talk to me. So I already knew that it wouldn't be very good news. So I went to his office, and then when I went there, he said, yes, you're right. It is a breast cancer, so we have to go and check that. It is aggressive and stage 3. So which means that it is almost spreading, but seems that there wasn't a spread yet, but he couldn't know. So he sent me to a breast cancer specialist, and actually I was expecting to go for an oncologist straight away. So I was surprised, and it was a very good surprise, because the doctor was just amazing and very, very positive. And I believe that it's absolutely important for the doctor to be positive while a person is dealing with that. Unfortunately, not all of the doctors can be strong enough to deal with that in a positive way. So when I went to this office, the surgeon, he said to me, look, it is fixable. So first of all, just be calm. I don't know how long, I don't know how it is the picture, because I have to do other tests and see if it is spreaded or not. If it is spreaded, we'll go and fix in the best way that we can. If it is not spreaded, then perhaps we will not even need to go for chemo. You will just need to go for surgery, and it will be a very simple one. And then I went to all of the tests, and then apart from that tumor, I already had 2 other small tumors in the same breast. and one of the lymph nodes has shown as being cancer too. So this doctor told me, Lydia, you have to go to chemo because that lymph node, however, is just one, and I will take everything in the surgery. That one can spread to other organs, and I don't want to have any chance, I don't want to give any chance for that. So you can choose, doesn't matter, but you can choose to have the chemo or the surgery beforehand, but you have to have both. And then I realized how it is to start having negative thoughts and not coping with the treatment, because when I went back home, I had all of the symptoms that a person that has cancer have, or a person that is passing for chemo, but I wasn't having any symptom before I had talked to the doctor. And I haven't started the chemo either. So I start having like a diarrhea, and I start having constipation, and I start having like a nausea and vomiting, and then I couldn't sleep, and I start feeling the nipple having the same tingling in the other side. And then I start feeling another lump in the other side, and then I just got crazy. And I called to this doctor, and then he says like, okay, just come here and we will talk. And it was a very good talk. And then he said, Lisha, that it is no way to spread that fast. So just please be calm, because it's just your mind tricking you, And then I said, no, I really don't want to wait. I want to have the chemo straight away. And then he says, okay, so you know what? I will send you to an oncologist, and then you will talk to this oncologist first, and then we will arrange the chemo, and then after the chemo, so we go for surgery. So I went to the oncologist, and the oncologist could feel the other lump as well. So I could understand when the hypochondriacs, they have this kind of feeling that it's very well described, that they feel even relieved when the doctors really see that something is wrong. It's very, very tricky feeling, because I was terrified of the fact that could be spreading, but at the same time I was relieved, because I could have a doctor that really could feel what I was feeling and could really understand what I was, the urgency to go straight away for the treatment. And then this doctor, I went on Monday to the oncologist, and he says like, generally I give some time for people to think about it, but you seems to be very certain about what you want. And because I could not have babies anymore, I have no time to save the eggs, I wouldn't even have the money for it. So we have to manage to talk about all of my future in one afternoon. And but he said like, look, you seems to be very certain about what you want, and so I don't want to miss any second of it, and I will start your chemo straight away as soon as I can. So on the Thursday I start the chemo, and it was the red one, so it is the known as most strong chemo, and then the one that gives you more side effects. And I was happy and I didn't have anything. And it was the very first time I understood the difference between coping with the treatment and having prejudice against it. Because it's very, very common for us that are passing for a cancer to start thinking that the chemotherapy is poison, and that it will kill you, and that you will not be able to bear the treatment, and it will be disgusting, it will be annoying, you will lose everything, And actually I didn't have much side effects. I had some, but very slightly ones. And I understood that what I was having, it's actually not a side effect. I was having a detox effect, which is, I believe, whatever side effect of your body have, doesn't matter the treatment that you are receiving. Because you are putting drugs on you, and let's face the fact, it is toxin. So it is not poison. It is not meant to be killing you, it's meant to be treating you. So it's just the way that we face things. So I decided every time I will have a side effect, I will not judge that. I will just shut up my mind and just be focused in coping with my body and listening to my body. So if I were having constipation, I will eat things, or I will be doing things to help with the constipation. If I were having diarrhea, I will eat things and do certain things to help with diarrhea. And then my body started understanding, and then after that my body started just normalizing and going for a good routine to cope with the treatment, because my body understands what I'm asking, and my body understands what is going on. So the today's video is just like the aim message is just like the difference between the negative thoughts and coping with the treatment. It's up to you, and so it's up to you to shut up your mind and not feed those bad feelings and those bad thoughts. And I know that it is difficult to be positive right now, so don't force yourself to be positive if you are not, but just don't feed the negative thoughts that you are having. Just don't judge them, and just be focused in helping your body, listening to your body, and coping to your body during the treatment. So, well, if you like the video, just please thumbs up, and share the video with someone that it is passing for it, and perhaps you can help. Okay? Thank you so much for watching.